Today we're going to talk about turning and repositioning and skin injury prevention. Skin injury prevention starts with everyday tasks including check and change as well as positioning before, during, and after changing. Always leave the bed rail up on opposite side of where you are standing. Bed rails should be completely up and secured when you move from the side of the bed. Flex the person's knees slightly. Roll over to a side-lying position. Unfold a disposable brief, and then after rolling the pad or brief to halfway, slide it under the back side of the person. Roll the person back onto their back. Continue rolling to the other side. When the brief or pad is visible, gently pull it out flat. Smooth out the pad or brief. Gently roll the person onto their back with pad spread neatly underneath them. Pull the pad up between the legs of the person evenly and smoothly. Tape down the tabs, beginning with bottom tab and ending with top tabs. If you are placing a brief on a male, ensure that the penis is positioned downward. When a resident is dependent for positioning and/or incontinent, there will need to be special attention placed on positioning. You will need the following items for positioning in a recliner or bed. Flat sheet, a draw sheet or flat sheet folded in half, a reusable or disposable Chucks pad. Then follow the positioning book guidelines for pillows, etc. Here are just a couple of examples of how this should look before placing your client in either a recliner or in a bed. Skin tears become more common with age. As you get older, the blood vessels in your skin start to feed less moisture and nutrients to your skin tissue. Other people, particularly if they are frail and need help moving around, are likely to get skin tears. Thinner skin means you lack the cushion you had when you were younger. Even a slight bump can tear the skin and make blood vessels break open and cause a bruise. Along with aging skin comes slower healing and diminished tensile strength. When a skin tear occurs and heals, that area will lose approximately 25% of its strength to protect and heal from skin tears and breakdown. The longer an area is open or intermittently broke down, or open will become harder and harder to heal as the tensile strength declines. For limited mobility, people with impaired mobility can be more prone to falls and accidental injuries that can lead to skin tears. People with cognitive impairment or dementia may get agitated and accidentally injure themselves. People who have had skin tears before or have chronically dry skin or thin skin, for example, long-term use of certain medications such as topical cortisone creams, can be more likely to have skin tears. Ways to help alleviate skin conditions are adequate personal care, drying wet skin in skin folds, and using ordered creams or ointments or specialty dye perfume-free products. Residents with orders for specific moisturizers, soaps, deodorants are due to skin conditions. Follow these instructions will help prevent skin conditions for these individuals. Certain medications such as aspirin, anticoagulants, antibiotics, corticosteroids, and diuretics can make you more prone to skin problems like dryness and bruising. You will notice that some residents bruise easily, or take longer for bruising to resolve, or have cold feet or legs and have overly dry skin even with moisturizer use. These will require closer observation for wounds or breakdown. You can help prevent skin tears by dressing your residents in long sleeves, staying hydrated, or taking steps to avoid falls, or using the proper skills when turning and repositioning your residents. You will notice a lot of residents wear long sleeves and pants during summer months. This helps protect their skin. Hydration is a huge factor in skin integrity. Unless a resident has a fluid restriction, please offer fluids all throughout the day. Decubitus ulcers are also known as bed sores, or pressure ulcers. Injury to the skin comes from the pressure on a part of the body where there is loss of circulation, which destroys tissue. Pressure is first visible as a red area that does not blanch with pressure. When repositioning, if you notice a red, dark area, press gently in the center of the area with one finger. The area should blanch to white and then return to red. If the area does not blanch to white, notify your nurse. Any part of the body can develop pressure injuries, but the areas most at risk are parts overlying a bony prominence. When repositioning from sitting to laying, etc., check these common areas for redness that does not resolve when position is changed. You can see the examples to the right of all the areas where pressure injury is most common. There are 3 primary contributing factors for bed sores. The first one we're going to talk about is pressure. Constant pressure on any part of your body can lessen the blood flow to tissue. Blood flow is essential for delivering oxygen and other nutrients to tissues. Without these essential nutrients, skin and nearby tissues are damaged and might eventually die. For people with limited mobility, this kind of pressure tends to happen in areas that aren't well padded with muscle or fat and that cover over a bone, such as the spine, tailbone, shoulder blades, hips, heels, and elbows. Tissue death can happen in as little as 15 minutes. If you have a resident who is losing weight and has increased bony prominences, be sure you are offloading pressure regularly. The next 2 contributing factors is called shearing and friction. Shearing occurs when 2 surfaces move in the opposite direction. For example, when a bed is elevated at the head, you can slide down. As the tailbone moves downward, the skin over the bone might stay in place, essentially pulling in the opposite direction. Friction occurs when the skin rubs against clothing or bedding. It can make fragile skin more vulnerable to injury, especially if the skin is also moist. This is where using appropriate positioning technique is key. Clothing, briefs, and padding cannot be pulled out from under someone. When a brief is pulled out from between someone's legs or out from under them without rolling them, you will see shear and friction injuries. These are commonly seen in the groin, buttock, back, and hip areas when proper technique is not used. If not treated, wounds quickly get larger and become more painful. This circulatory interference is usually caused by pressure over bony prominences. The pressure can come from the weight of the body lying in one position for too long, from splints or positioning devices. Moisture from incontinence will decrease skin's protective qualities. Dark areas represent tissue death that will likely open. Blanching is when a red area is touched and the redness does not fade to white and then return. It is not blanchable. Redness that does not blanch or change in skin color for darker skin should be reported. Individuals who have a higher risk of developing a decubitus ulcer are those with braces or splints, chronic disease processes, neurological disorders, those unable to move, underweight or overweight, incontinent, diabetes, those with poor circulation, mostly for our aging individuals. Once there is a dark discoloration or redness that is not blanchable, tissue damage has occurred. Quick intervention is the only way to prevent worsening. Substances that can be toxic to the skin or make bed sores worse are things like continued pressure, heat, moisture, lack of cleanliness, perspiration, urine, feces, discharge from wounds, and soap that has been left on the skin after a bath. Follow the 24-hour schedule for position changes. For example, if you have someone who is to be out of the wheelchair between 10 and 10:30 a.m. and 2 and 2:30 p.m., then we need to get them out of the wheelchair. Prevention of decubitus ulcers or pressure sores. Reposition frequently, at least every 2 hours. Turn individuals who cannot or have not turned themselves. Keep the individual clean and dry. Wash skin with soap and water to remove body fluids, and keep linens and clothing as wrinkle-free as possible. Inspection of the body should be routinely performed, and the first sign of a sore is to be reported to the nurse. These are the reporting guidelines. For CNAs, tell your nurse, fill out Mark's card and blue injury report, give the Mark's card to the nurse, and add the findings in the logbook. Call team to fill out injury logbook, and then write in house injury logbook. For the nurses, the nurse will assess reported mark or lesion. If treatment is needed, they'll write the MD note. The living unit nurse will receive the orders, then transcribe the order and add to the CNA treatment sheet if needed. and then write directions in the Living Unit logbook. If in doubt, you can always contact the wound care nurse at extension 296. Thank you.